The health visitor is really great. Like, they actually care about people and care about the community, and they've been in the spot that we've been in before, so.
Today, street outreach was in the spotlight during a Multnomah County board meeting. Commissioners looked at outreach services that the county funds with taxpayer dollars to check on how that outreach is going and where there needs to be improvement and more accountability. The meeting came at the request of Commissioner Shannon Singleton.
This work session was requested so that we can really understand our outreach services, whether it's navigation, inReach, and you'll learn that these are all different across both city investments and county investments, again, in light of both jurisdictions being in a scenario of budget reductions.
Okay, so everyone is really feeling the pressure of the budget cuts that will soon be coming to these county programs. And that pressure is really setting the tone for these types of meetings. Now, the data at the center of today's briefing revealed there are a lot of groups doing street outreach, but a lack of consistency on how that work is measured and a lack of coordination between those groups, which hinders the county commission's ability to make critical decisions.
To me, we're missing data and then sort of this systemic approach of like what is a successful outcome and how do we track that?
This has been a patchwork over time. There was outreach that was happening. It was like one agency, and then there was a need for mental health outreach. And so then that got developed. And so it's just been kind of funding and filling gaps over time. So it isn't quite a system yet.
Outreach has been something I think that we've all been interested in, definitely on my board, on my time on the board, getting to, understand what is happening and how we can be more effective and efficient.
Today, commissioners heard from several groups that offer outreach and housing services. Most use county money to do so. We're going to focus on the Homeless Services Department and the Behavioral Health Division, which targets people who are homeless or at risk of becoming homeless. And commissioners also heard from the City of Portland on their outreach work as well. But let's start with the county's Homeless Services Department. That's the group that distributes local, state, and federal dollars to nonprofits that then try to address the crisis on our streets. The county contracts a total of more than $9 million for that department's outreach services. There are 12 separate service providers who receive between $420,000 to nearly $2 million out of that $9 million. Now, as you can see here in this chart, the county isn't naming which groups are getting this money. They simply just say program 1, 2, 3, etc. But if you look closely, some programs, like that program number 5 that we just highlighted for you, gets the most amount of money meant for outreach, $1.7 million, with 7 employees and a goal of getting 120 people placed into housing. Here's Deputy Director for the Homeless Services Department.
We've recognized recently that we need to kind of get our arms back around what outreach is and what we want it to do in the community. So we're in the process of doing sort of an evaluation of Homeless Services Department outreach and how we might be able to better coordinate that in the community and make sure it's better aligned with the resources to get folks into housing.
Now, another outreach group the county helps fund is the Behavioral Health Resource Center. That's this building in downtown between Southwest Oak and Harvey Milk Street. It's a drop-in day center for homeless people struggling with mental health issues or addiction. It also has temporary housing. And it's where I met a man named Alan today. He was there getting help.
Yeah, 3 years ago, I was the very first person to ever step foot in here as a participant and receive services. They help you get ID document ready if you ain't got your documents, and then they move you to the 4th floor and get you into an apartment or get you into some kind of housing.
So the program that helps people like Alan costs nearly $6 million. Multnomah County pays for about $1.4 million of that. Now, from July to December of last year, staff there has encountered more than 1,200 people and referred 851 to housing. Alan says he was one of them. However, today he was back on the streets.
But they've helped me get into tiny homes. They've helped me get into really good shelters instead of being on the streets and being unsafe.
I would really encourage, as we sort of walk through this conversation, that we have rigor around the word referral. A referral can't be like the end answer. It's like, because I think that will prevent us from knowing whether those referrals are successful.
I do think we have work to do to support the health department in capturing any sort of housing placement outcomes. And again, whether that is a treatment or moving in with families and friends, those positive outcomes, if you look at the data, is something that isn't there, at least in what we're currently capturing.
All right, now let's talk about the city of Portland and the outreach efforts there. The city has what's called the Street Services Coordination Center. That's the group that leads camp removals and helps get people into shelter. It's often those tiny home villages that the county helps pay for. The city program's annual budget is $1.3 million. Now, the latest data shows that in the first week of April, 55 people expressed interest in shelter. 31 accepted a referral, and 18 people stayed in a bed for at least one night. Now let's remember, there are nearly 15,000 homeless people in Multnomah County, and the city has just 5 designated outreach workers. Here's Skylar Brocker-Knapp representing the city of Portland today.
And the Street Services Coordination Center was developed to really focus on those high impact campers, folks who really were not being addressed by any other kind of mechanism within the system. So really wrap our arms around all of the aspects of outreach, housing placement, and resource connection for those folks that we were really seeing time and time again.
There's also a group that's part of Portland Fire and Rescue called the Community Health Assess and Treat Team, also known as CHAT. I went on a ride along with them last year, and here's footage from that day. They have a team that responds to overdoses in the downtown core and teams that respond to low acuity medical calls. They also follow up with patients the next day. The goal is to free up firefighters and space in ambulances and emergency rooms. I caught up with Rick Graves today, the spokesperson for Portland Fire.
It is an incredibly beneficial program to our community. It has diverted many, many people away from the emergency rooms. It's worked with people on getting them in treatment. It has rehoused individuals. It is the broad footprint that they have in our community is significant. It may not be deep because our funding is not necessarily as great as we would like it to be.
CHAT's budget for this fiscal year was just over $4 million, and they've diverted an average of 30% of patients from going to the emergency room and 15% of patients from riding in an ambulance. According to the county, CHAT saved the hospitals and ambulances about $10 million. But get this, these stats are actually lower than when the program first started in 2021.
Those numbers are a little lower than I'm used to seeing. You know, when the program was established 4 years ago, we were diverting upwards of 75% of the potential patients away from the ED, critically at a critical time, right? That was when AMR was really having difficulties and the community was forced in this level 0 situation. So any ED diversion, any open ambulance was a certain win.
So why are we seeing 30% diversion rate when you said when it kind of started it was much higher?
You know, I'm unable to land on a definitive reason. Any diversion is good. Maybe the early diversions were simply easier cases. Maybe now we've got to the point where we're in society where people are on the edge and maybe they do need a higher level of medical care. Maybe we're catching them, you know, later in the period of I am struggling to thrive. I don't know the reasons for that. It'd be awesome if we had CHAT in service 24/7 with 10 crews across the community at all times. And maybe they would do such a good job they would actually eliminate their need, right? They would be able to get at all these folks that just have lost connection with how to take care of themselves given the system that we live within.
So those were just some of the outreach groups highlighted during today's meeting. But the County Commission wants to make changes to how much of this work is tracked. So starting this next fiscal year, which begins in July, outreach groups funded by the county's Homeless Services Department will be reporting weekly on where they're doing outreach, how many people are on staff, and the number of homeless people they've connected with. The county will also hold listening sessions with providers to create an outreach manual, which will include a set of policies that all providers will be asked to follow.